I didn't get a chance to see the president's message yesterday, but I saw some of the after effects and some of the news conference. What's the takeaway is we have a democratically controlled legislature, and we see Henry Waxman and several other Democrats standing there saying the brakes on. They're concerned about moving this plan too fast. Today's been very helpful in terms of sharing information, helping me to understand what's going on, but how do we get the average person to understand the messages that we're seeing on the news? I was like flabbergasted. I'm thinking, well, I thought the Democrats were in support of this, and then here we see several key figures standing there saying, wait, what's the takeaway message here? And I have to tell you, we had a very heated discussion in our office yesterday in terms of trying to understand what is this healthcare reform and what are some of the takeaway points that we need to be following or helping our constituents to understand, especially the clinical.
That's a great question. I don't know if I have the perfect answer, but I would advise this: don't try not to get too caught up in all the posturing of all the different players. Try to get to the bottom of it, what's really going on here. And Waxman may say one thing because he needs a vote from somebody over here, and he's willing to say something publicly. Otherwise, he might not go down that road, but he knows he needs to go with a few people on his right. So you kind of have to look beyond that. I thought the president did a very good job yesterday of explaining why it has to be addressed, both the economics and the uninsured. He was, to me, a little less convincing because it's harder to do, to sell a particular solution, because he doesn't want to sell a particular solution yet. I think as long as we have a number of balls in the air, it's a little harder for the opposition to pick away at one thing. If he comes out and says, I want this, people are going to line up against that, and he'll have to defend for 3 months. Keeping all the balls in the air, in a way, confusion may be difficult for the public, but it's in some ways better than the inside game. Although I do think at some point, and I think Schwarzenegger and the Democrats had trouble with this in California, until people really know what they're getting, it's really hard to mobilize people to go out there and fight. They're just saying we want health reform, but they don't really know what it is. It's hard. So I think he has to work a little bit harder as we get to this congressional recess to say this is really what it's about. 1 or 2 points and hammer those on.
I agree with Baldwin. I think that the president has this difficulty of if he comes out for particular elements, he's very vulnerable if he doesn't get those elements. One, they become a point of attack, as Walter was indicating. And secondly, he's weaker if those are stripped away from the bill, politically. And as he noted last night, I think it's no secret that there's a lot of Republican strategy out there that says, kill healthcare reform and we will weaken Obama as we did Clinton. We will recapture the House or have a chance at it in the midterm election. So I think there are a lot of political obstacles he has to overcome. Waxman is perhaps the strongest committee chair, one of the strongest committee chairs in the Congress, who's got central responsibility for healthcare reform. One of the strongest in support of what I would consider to be a very progressive and very good healthcare reform. His committee, the Energy and Commerce Committee, he has 7 blue dog Democrats. They are acting as a bloc. If they vote with Republicans, they kill the healthcare reform bill in the House. So he has to play ball with them, which is why he's delaying the vote. It's not because he wants to delay the vote. I know that he wants to move that bill out of the committee. But he can't do that as long as he's got this threat of basically killing the bill from a small group of Democrats who aren't willing to go along with leadership in the House and in the Republicans.
Thanks, Rick. We're going to have 2 more questions. The first one is from Betsy. Betsy Crowe.
Thank you, Ron. You know, I think something about us culturally, societally, is those of us
the microphone.
that are insured those of us that are insured, we're really great demanders of health care. And I wonder what we do about our own individual behavior. Many plans have individuals who are fully covered. They may pay the copay, but no portion of the premium. So there's not much incentive for them not to use it. I add myself to that list now that I've had knee surgery and I have a pre-existing condition. I want everything done to this knee possible. But I also am very struck also by end-of-life care compared to other countries. We're very loath to use the word rationing, whereas other countries and societies do, because for the collective good, you have to preserve dollars to put them on the front end toward wellness and prevention and what's good for society. And I don't see that kind of sense in our country. We see much more divisive than that and much more centered on trying to figure out in all of this where we're going to land and what's good for us, and am I going to be made better off or worse off?
One more question, please.
I would just say, if I may, I don't think we're any different than any other country in that respect. I just spent a week up in Vancouver, British Columbia, and right now there's exactly the same conflict going on in British Columbia and throughout much of Canada about how much the government's going to spend, about cutbacks, about waiting lists, about efforts to privatize the Canadian system because of the waiting lists and shortages in some areas. And so we still see the same kinds of conflicts going on there. They, of course, have a different framework in which they're taking place, one that already provides a great deal of solidarity and support.
And Betsy, I would say I agree with almost everything you say, and I really hope not a word of it gets into the current health reform debate. Because the last thing we need is to start talking about ways we're going to have to cut back, not being able to go to the government fund, not being able to get the care we need. Let's put that off until after we pass this.
Understood. Do I see another hand for a last question? One earlier. Carl?
We'll go back to this, the notion of how the package thing, how it gets eventually sold in some manner to the public. I was impressed yesterday evening listening to the president. In the first 4 or 5 minutes, several of his responses all used the term health insurance reform. And then it slips into, and you guys have used it a lot, health care reform. And, you know, I think one of the lemons, we as intellectual professionals out here, we kind of understand some of the jargon, but there's a reality out there, I think, that people still don't know what we're talking about. Because when you start talking about rationing, or you start talking about what something's going to look like, you talk about the public plan. That's an insurance reform issue, as opposed to decision-making around the kind of care people are going to get, or the studies that people want to do, say this is the Cleveland Clinic is a better way to do something than Healthcare Partners has. That's care. That's nothing to do with insurance reform, in my opinion. I'd like to hear your comments on that, because it seems to me that's part of the confusion that's out here. That what are people going to take away and really understand so they can tell their elected officials, we want change. What is the change we're asking for?